These products are cryopreserved. So that means they're frozen and they're kept frozen until they're shipped out to you. Once you receive them, you can thaw them and then turn around and inject them into the patient. When they tested these thawed amniotic products and they put them on a petri dish and they tried to culture expand them, just like you can do with your fat or your bone marrow, they found that there was no live cells out of any of the 9 products. These cells did have leukocytes. These cells did have growth factors. They did have matrix, so there may be some benefit to them, but there were no live cells, what's often being claimed that they're selling. And then let's talk a little bit about the IV infusions. I mean, it sounds great. We have these magical stem cells. Let's put them in our IV. They'll find whatever hurts and whatever ails us, and they'll land right where it's supposed to be. The biggest issue with IV is that these MSCs, when they're injected into the IV, they got to pass through the lungs first. And with the size of the MSCs are usually too large to get through the capillaries and the pulmonaries, so 95% of them typically get trapped in the lungs. So very few of these cells actually get through. And so with only 5% of these cells getting through, the question is, what are they really doing? Are we really getting any great benefit from it? And so I think there's a lot more research that needs to be done to really find out if that helps and if it really is making a difference. Now let's talk about our safety issues. So the things that we worry about are we worry about infection. So the infection can come from having poor sterility. The infection can just happen from any time you have an injection, you get an infection. We worry about bacterial or fungal type of issues. Next, we worry about rejection, especially if we're using someone else's tissue and injecting into you. We know that you can get a graft versus host type of response, especially if we don't have the strict kind of FDA or good clinical practice, guidelines are being followed.